at the front line of all these things we are talking about. Primary healthcare level, and in particular health equity. And we also, you work great work with mothers, you're a mentor yourself, working in the space of PMTCT. So what does health equity look like, in the work that you do? And what are some key priorities that you focus on to achieve all this that you have achieved and much more?
Thank you very much, all of you. It's such an honor that for the first time, community health workers are now at the table, sitting at the decision-making table. Because let me start from there. There was a lot of inequity from top, from the ministries of health themselves. Because if community health workers were not involved in tables like this, then inequities started from the ministries of health themselves, ourselves as workers. From a community health workers' perspective, health equity is achieved when everyone can attain full potential of health and well-being. And from a perspective of a community health worker who sits and stays closer to the problems, as we know that outbreaks and pandemics, they will start and stop right at the community, where majority people are, where women are, where children, infants, we cannot find infants here, but we can find them in the community, we find them in the community hospitals, we find them in the Ward 5. But when we come to here, I think we should start with equal representation, and I'm so happy because we are taking the steps of even engaging community health promoters in stages like this. And advocates for community health promoters of Kenya are there to advocate for equity in distribution of resources, in distribution of health resources. One of the factors that we are looking when we are advocating is the improving access to the primary health care. Primary health care is the backbone of health. When we are sitting here, I remember 3 weeks ago when we were sitting in New York, and we were discussing issues of there was an issue that was being discussed about multi-drug resistance diseases. And I came to realize there is somebody who said that since 2016, multi-drug resistance was being discussed at high-level meetings like the ones that we were having in New York. But interestingly, from 2016 up to today, up to 2024, there was no change, and we were asking why. And when I said that it is the first time for a community health worker to be involved in such discussion, and this became, this is a gap, because when community health workers are not involved in such discussions, these discussions will end, they will start and they will finish at the top level. And the pandemics will continue surging at the community level. So what we do is advising the governments and bringing governments to dialogue and just saying that, hey, there is a problem here. We are not getting equity in resources, in health products, because at the ground level, there is no provision of quality care. And I'm so glad because right now the Ministry of Health is involved with the community health workers in decision making. And I think this is the way to go. So we should improve primary health care from the community level. Those are doctors, nurses, they should come right in the community where the real problem is. So I would just say, the way Professor Margaret say, start where people are. Let's start where people are, and that is my call today to the people who are staying here at the high level. You might not know what is happening in Mathare right now. We might not know why monkeypox was killing people, more than 5,000 natives in Congo. That shows us that there is a real gap that has to be filled, and that shows us that there is still inequity in distribution of health resources. So, as community health promoters, we are looking for other community health promoters within Africa, so that we may brainstorm and discuss together as one family to know that what is happening in Congo, what is happening in Ethiopia, is it the same thing that is happening in Kenya, so that when we compile all these reports, we can tell the African CDC, we can tell the African Union that we have this issue at the community level. And while our community health workers should be involved in such discussions, is because we know and we detect and respond where the real problem is. Up here, we might not know what is happening in the slums, but a community health worker can detect and respond right in the community. I can give an example of Margret outbreak. There is this community health worker, a 24-year-old girl, who was just going around in the houses, and she came to realize that there is a house that 7 people died within a span of 1 year with the same condition. And she reported this to the Ministry of Health in Tanzania. And that is how Margret was detected. And that is how right now the globe is safe from Margret outbreak. So these community health workers play a critical role in promoting primary health care.